Hi, I'm Professor Ridhi Kashyap from Oxford's Leverhulme Centre for Demographic Science, and today I'm going to talk to you about a paper that I've co-authored with colleagues from the Max Planck Institute for Demographic Research and other institutions in Europe, and the paper is Life Expectancy Changes Since COVID-19. So we worked on this study with multiple institutions, our collaborators at the Max Planck Institute for Demographic Research, as well as those at the London School of Hygiene and Tropical Medicine, the Centre for Population Dynamics at the University of Southern Denmark, Tallinn University, and also University of Cambridge. So our study analyzed life expectancy changes during the COVID-19 pandemic in 29 countries. Our main finding was that across Eastern and Western Europe, we saw an interesting divergence in patterns. While in Western Europe, we saw recovery from the losses of 2020 across most of Western Europe, in Eastern Europe, we saw compounding or worsening losses in 2021. We also saw an interesting association between vaccination and life expectancy losses. So places or countries that had more vaccinated saw smaller life expectancy losses. So this research helps us understand the cross-national impacts of the COVID-19 mortality shock. This kind of mortality shock that we saw during the COVID-19 pandemic is truly historically unprecedented when we look at mortality trends in the last 70 years. By learning about these trends, we can actually better prepare for future shocks and also understand that there is heterogeneity in public health responses that have real impacts. So, for example, we see the divergence between Eastern and Western Europe or the differences by vaccination rates, and this tells us the importance of good public health planning for recovery. So we're expanding this analysis of COVID-19 and digging deeper into different countries to analyze how COVID-19 played out and impacted mortality in different parts of the world. And we're also interested in how other causes of death, not including COVID-19, shifted during the pandemic, so we can better understand what recovery looks like in the future.